Often, patients will present with a painful toe or a painful lesion under the toe. A hammertoe procedure is usually performed on one of the lesser digits. Conservative care options include wearing non-constrictive supportive footwear, using appropriate footwear with orthotics or orthopedic inserts, and on occasion, appropriate padding may be rendered. Should you, the patient, become frustrated with these conservative care efforts, surgical intervention may be contemplated. If surgery is indicated, a simple procedure often will provide lasting relief. During your preoperative visit, discussion of risks and benefits, including relief of pain. However, there are risks including that of perhaps soft tissue or bone infection, recurrence of this problem, as well as painful scars or perhaps permanent numbness. Other risks and benefits may be reviewed, and all questions are encouraged and should be answered prior to an operative procedure. Specific preoperative instructions are provided to the patient. Preoperative instructions including nothing to eat or drink after midnight on the day of the procedure, as well as directives for keeping the area clean and dry, and appropriate use of postoperative medications are covered. As you arrive in the operative suite, the patient is usually moved from a gurney to an operative table. Once appropriate anesthesia or sedation is provided, the involved digit is cleansed with alcohol or betadine or appropriate PrEP antiseptic. Local anesthetic is infiltrated around the base of the toe and perhaps even into the metatarsal area as needed. The foot is appropriately prepped and draped. After the surgeon has scrubbed his hands, the surgeon is then gowned and gloved. A tourniquet may or may not be used. This may be used at the level of the ankle or the calf or the thigh, or perhaps a digital tourniquet may be utilized. If the apex of the deformity is over the proximal interphalangeal joint of the digit, a 2 cm dorsal linear incision is performed over the proximal interphalangeal joint. The incision is deepened through the epidermal and dermal layers of the skin. Blunt and sharp dissection is carried through the fine layers down to the level of the proximal interphalangeal joint and the level of the long extensor tendon, which extends over the proximal interphalangeal joint. The area is irrigated. Electrocautery is utilized as necessary. The long extensor tendon is released at the level of the proximal interphalangeal joint. A sterile scalpel is again used to release all soft tissue structures around the head of the proximal phalanx. A small saw, utilizing either a sagittal or an oscillating saw, is utilized to resect the head of the proximal phalanx. Again, the area is irrigated. Any sharpened edges are smoothed with a rongeur or hand or power instrumentation. The long extensor tendon is then reapproximated with 3-O-vicryl, and 4-O-proline is then used to reapproximate the skin edges. A sterile non-stick dressing is applied over the surgical incision site. A betadine-soaked 2x2 is wrapped around the digit. A supportive dressing is provided to the foot. An ACE wrap may also be applied to the foot, ankle, and lower leg as needed. After the appropriate post-anesthesia period has passed, the patient is discharged to home with specific directives for appropriate use of postoperative pain medication, the need for elevation of the foot and keeping the dressing clean and dry, and the patient is also advised to follow up as directed. The patient is also advised to call should there be any questions or problems that may arise at any time. More often than not, an uneventful postoperative course involves dressing changes through the first week to 10 days, as well as likely suture removal at 1 to 2 weeks at the discretion of the surgeon. It is important to have close follow-up with your surgeon, as complications may occur. Should a complication of a postoperative infection or other problems occur, these are issues that can be brought to the attention of the surgeon during the postoperative course following your surgical procedure. It is important for you to contact your surgeon should you have any questions or problems at any time following your procedure.